Say the clock. Good morning.
You're going to be out. You're going to go.
For the record,
you're going to stay out.
Okay. There is a copy of the Open Meetings Act on the south wall of the legislative chambers. We have a copy of official notice, and say the clock. We'll call the April meeting of the Douglas County Board of Health to order. With that, Sunday roll call.
Okay, Wilkin. Here. McNally.
Here.
Rogers.
Here.
Wade.
Here.
Weiss.
Here.
Gray.
Here. On the phone, I saw Simon. Well, on the group meet, so Dr. Philippi. Any other board members on the GoToMeeting? Other than I see Kurt, Simon, Dr. Philippi. Okay. With that, we got item 2, which is approval of the meeting minutes for Wednesday. Is there a motion?
So moved.
The second. Second. Motion, second, roll call.
Rogers.
Yes.
Wade.
Yes.
Wilkin.
Yes.
McNally.
Yes.
Weiss.
Yes.
And Gray.
Yes. Item 3 is approval of action items. I like to approve items. I like to remove D and approve D separately, just because I need to vote of conflict. And so if there's a motion to approve A, B, C, E, F, and G, there's a motion. Is there a second?
Second.
Motion second, roll call. 4.
Gray.
Yes.
McNally.
Yes.
Rogers.
Yes.
Wilkin.
Yes.
Weiss.
Yes.
Wade.
Yes. Is there a motion to approve item D?
So moved.
Motion is there a second?
Second.
Motion second. I need to abstain because I sit on that board. Roll call.
Wade.
Yes.
McNally.
Yes.
Rogers.
Abstain.
Wilkin.
Yes.
Weiss.
Yes.
Yes. Item 4 is public comment. I'm aware of none because of the situations. So with that, we'll go to item 5 and issues for discussion. Of course, the COVID-19 update, Dr. Poole.
So thank you, board members, and good morning. And I'm going to take my mask off so it's a little bit better. What I was going to do this morning is also really give you a little bit of history, because I think now we have had time to kind of look back. When I look back, this all potentially started February 7th. And if you remember, at that time, we had 57 individuals from Wuhan who were evacuees who came and were housed at Camp Ashland. February 17th, there were like 13 individuals from the Princess cruise ship that arrived at UNMC, and that really started to get us kind of in this mood to try to, what do we need to do about COVID-19? On February 20th then, we had all these 57 individuals from Wuhan who were able to go home, and fortunately for all of us, none of them got infected from the time they were here. For us locally, it started really March 6th, because that's when we had the first individual who, if you remember, the individual came back from England, for quite some time, was in the community, was potentially asymptomatic, but some slight symptoms. He had some underlying illnesses, therefore exposed quite a few individuals, and especially healthcare providers in our community. That really got us to do the first direct health measure, and we did that actually the afternoon of last month's Board of Health meeting, March 15th. That was the direct health measures that we did for Douglas County, which was followed by the governor's direct health measure the next day. We then had a second community-acquired case, which was an individual who really, after all the investigation we did, we could not find a potential exposure. Person didn't travel, didn't have contact with an individual. So that was for us the indication that potentially the virus was in the community, and therefore we actually needed to amend our direct health measure. Now we are on April 15th, and April 15th, we all remember usually the tax day, and all of us are a little bit anxious to have everything ready for that day. But today we are at 255 cases in Douglas County. So within 5 to 6 weeks, we have gone from 1 case to 255 cases. As of today, we have 7 deaths in Douglas County. We have several outbreaks that I just kind of want to highlight to you. Several in long-term care facilities. And when we look at those long-term care facilities, we are realizing that the workforce really in some of these facilities is weak, is probably not as prepared in regards to PPE and infection control as we would like to. And so from the 255 cases, we have 40 of them in healthcare workers, and we have 69 of them in long-term care facilities. So that's close to 50% of our cases. I want to talk a little bit, and we'll have some opportunity with some of our guests later on to talk about race and ethnicity. And we have made a conscientious effort from the beginning that we were looking at race and ethnicity in every case that we have. Remember, some of these cases come to us from laboratory reports. We then follow up over the phone with them, but sometimes it is a little bit more difficult to find out what the race is. We have at this time, we have African Americans, 54 of them, which makes up 21% of our cases. We know the African American population in our community makes up 11.4%. So we are already seeing, and I have followed the numbers very closely over the last week or two, we are seeing a slight increase in that population. When we look at the Hispanic population, we have 26 cases of that population, which presents 10% of our reported cases. That population makes up 12.8%. I like to look at exposure really. When our EPI staff does exposure and investigation with those individuals who are positive for COVID, we really try to determine how was that person in contact, with whom were they in contact, and what was their potential exposure. So in the beginning, it is very interesting for me to look back. In the beginning, it always used to be people came back into this community traveling from somewhere, potentially an area where there were high exposure, high incidence of COVID-19. And they brought, I like to say, the virus with them back in our community. Since then, it has changed quite a bit. And now what we are seeing, the highest percentage is actually individuals who have had contact with a positive COVID patient. That means they could be household members, they could be at work where they have had relationships or close contact. And by close contact, let me just emphasize again, it is closer than 6 feet over 10, 15 minutes. Over 10 minutes, we usually say, some countries say over 15 minutes. So it's not just walking by somebody in a grocery store who potentially is. But when we do those contact investigations, we try to determine then who did these individuals have contact with, and that's how we determine the exposure. So at this time, the exposure to a contact is at 51%. That means every single half of our that had contact with a positive case. And we see travel is only 18% of all the cases that we have in Douglas County. We like to look at what are the symptoms that we are seeing in our community, because we see a lot of national data. I always say it's important to determine what we see. 73% of our positive cases say they have a dry, persistent cough. That seems to be the one symptom that have been reported. Fever, only 58% of our cases are saying they have had a fever. So 42% do not have a fever. So where in the beginning we were saying that the fever is really an indication that you have COVID-19, I think we need to be very careful and say there are many people who do not have, who are afebrile and are still having COVID. 39% are saying they have a congestion, mainly a sinus congestion. Shortness of breath, 36%. And I like to share the one symptom which I do think is more and more distinct for COVID-19 is this loss of taste and smell. And we hear that, and I have a nephew who is COVID positive, and that is the symptom that is really taking him down, because it's that loss of taste and smell. He says it's a very unusual symptom to have. 29%, close to a third of our cases have that symptom. We always look at, when from the beginning we were talking about hospital resources. What are the resources in our community that actually could take care of COVID-19 patients? And at this time, this is reported on a daily basis to our healthcare coalition, who is a coalition of all the local health departments, not only in Douglas. There are one in South, there is one in Washington County, and there is one in Potawatomi County. So what we are hearing from this coalition is that there are 538 med-surg beds available in our community, 538. And you may say, well, that's an awful lot. And I do think that the governor's direct health measures that prohibited elective surgeries had something to do with this, because it opened up hospital beds. So at this time, 538 are open, and an occupancy rate of 58%, meaning half of the hospital beds potentially are available. We have 38 inpatients with COVID-19 at this time. And then let's talk about ventilators, because we hear on the national scene as well how important it is that we have ventilators available for individuals, patients who need it. We have 101 of the 402 ventilators that are occupied at this time, a fourth of the ventilators. If somebody gets on a ventilator, we hear from our cases, they are usually on for 8 to 10 days. So you don't go on a ventilator one day and off the next day. So when these ventilators are occupied, it's for a longer period of time. From the 101 ventilators that are used at this time, 15 for them are for COVID-19 patients. That's what we have at this time. Another report that I want to share with you, we are starting to have one person on our staff who, that's all he does, is he goes back and calls the individuals who were positive with COVID-19. We do this for individuals who have been going back to probably 4 weeks, so to say, in the beginning of the month. And he calls them up and he talks to them about, have you recovered from your symptoms? Or have you not? And what symptoms do you still have? So we have at this time 18 of our patients who are saying they have fully recovered. There are some who are saying there are symptoms that are still lingering on to them. Let me talk a little bit about PPE and how does that actually work. So potentially PPEs are requested through a request form to the health department, local health department here. We then provide that request form to the state, because the state has made a decision in the beginning that they were going to be the ones who were going to go out and purchase PPEs and then distribute it to whoever needs it. The bigger purchasing power you have, the better deals you are going to get. So that's all centralized at this time. We have been able to fill most of them. I'm not saying all of them. There are probably a few that we have not been able to fill yet, but we have sent those requests to the state. So we have an operation here. We are using the Douglas County warehouse, who is actually then receiving these items, and then we distribute it to our counties that are close by, Sarpy and Cass, as well as Southeast. And then we are also providing it to the healthcare coalition, so to say. And let me talk about some other things that the state is now developing. And one of them is, we always knew there will be a need for potential quarantine and isolation sites for individuals who cannot do it at home. So we are talking about quarantine sites, potentially for first responders, who cannot go home, but potentially have been exposed to an individual. But going home would mean going to a family who has small children, who has elderly parents at home, or so on. So the government, the state government, has developed contracts with certain hotels in each of the areas, and many hotels here in Douglas County, that were specifically designed for emergency responders, healthcare workers, workers in long-term care facilities, and staff. So those individuals have now an 800 number that they could call, where if somebody is on that number 12 hours a day, they will take them in, they will ask them some questions. That number then is transferred to an individual who is coordinating all of that and gets back to them within 24 hours. They then could go to that hotel, so to say, with some identification who gives them that side. What we are hearing by the end of this week, we should have dormitories here in Douglas County that have agreed to that they will be potential housing sites for the general population. So they will always use the same process that we use for the other staff member. There will be a phone number they can call in, and then they will be assigned to a dormitory. So the next level will be, what are we going to do for individuals who are positive with COVID, but they don't have symptoms that requires them to go to a hospital, but they cannot isolate themselves at home. So that is the next tier that the state is looking at. And the third tier will be for individuals who are in convalescent state, meaning they have been in a hospital, but now they really do not need that service anymore. They do not need to occupy that hospital bed. What are sites where we could provide, or where they could have provided some health care, minimal health care services, but could stay there in a safe manner. So that is tier 3. So the government is, the state government is working on those as we move forward. The one thing I want to share with you all, we have had that information line at the health department since March 9, and we have received more than 5,000 calls on that line. That line, as I have told you, shared with you before, has 10 lines coming in, and 3 of them are Spanish lines in addition to those 10. We have now been able to purchase work cell phones, so some of these individuals are starting to work from home. Because I tell you, that information will make me very nervous. It was too crowded, there were too many people in that room. So we have really tried as a department to encourage, and also our management staff, to really work from home if it is possible. We have been able to do a lot of work by a direct VPN into the computers that people have at work here. So if we have confidential information, we can work through this. I'm very proud. We still have some orders that have been in the queue for a long time for laptops, specifically for our big staff. But we do want to distance individuals, have them work from home as much as they can. I just want to share with you, some of you are following modeling that is occurring nationwide, and probably the best model is what we call dearly the Murray model. It comes out of Washington State, and what we are seeing in that model when we are plugging in data, local data, we see that we are potentially have the highest hospitalization at the end of April. And so then we are moving back and we are saying that means potentially the exposure is occurring now. Because you remember, once you have symptoms, you potentially have had an exposure 2 days before that or 3 days before that. By the time you are hospitalized, it may be very well 1 week into your symptoms. So we need to come back, and that's why I think it is so important that we are taking these measures at this time very seriously, so we potentially can see a flattening of the curve. We've asked the governor, and I have been asked many times, why do we not have a stay-at-home order? We're one of the states who is kind of sticking out in that regard. My message has always been, this is semantics, because our direct health measures had all those restrictions that you are seeing in the statewide stay-at-home measures. The restrictions on daycares, the restriction on restaurants, actually school closings have occurred in our community much before anyone else has ever talked about school closing. The closures of hair salons, massage parlors, and so on. I think we are very good. But what I have asked the governor, and the governor has really done well, is last week to come out with 6 rules. And he calls it rules, not just guidance, because rules, I think, for all of us who have been parents, a rule to a child means something different than a guidance. And so the rules have been very much stay at home, work from home, shop only once a week and shop by yourself, help kids really learn about this distancing, help seniors go shopping for them so they do not need to go out and exercise alone or otherwise really look at this distancing. Want to close with a few things that I have learned in these 5 weeks, who have been challenging for all of our staff. And I cannot say enough for our staff how much time they have all put in. They have all wanted to do the right thing and help this community. So I have wonderful staff. I'm very, very proud of them. But what we have learned, or what I have learned, is that relationships really matter. And they matter before you are in a crisis, because that's when you build trust. And I think the trust we have had in the relationships we have built with schools, for example, with the FQHC, some of them you see on the monitor there, are extremely important now. I think I have learned too that as an agency, we need to be flexible and nimble. And what do I mean by that? We had to change the way we are doing things. And we had to say, we are able to do that. For example, we had to train our nurses, because STD clinic is not a walk-in clinic anymore. We only are providing express testing at the clinic. But those nurses in the clinic, we all have them trained now to do infection control and to do contact tracing. So to be able to actually change that very quickly was very important. Thirdly, and I didn't know that, and I probably was a little bit reluctant in the beginning, is the importance of unified command. Unified command is this command structure that we have in place and are meeting every morning now to try to say, sometimes it just takes a half hour. What is logistic needing? What is operations needing, and so on. And then move that information up that route. And I never forget, one of the school superintendents said that they had a shooting at their school, and it was chaos until they really implemented Unified Command. And it was only until Unified Command was there an organized organization. And I can say the same thing for Douglas County. I'm really very thankful for Unified Command. The fourth thing I would say is good collaboration with elected officials is really important. Be it with county commissioners, be it with the mayor. You have seen all of the news conferences. We have county commissioners there, we have the mayor there. But also elected officials with the governor. We have now weekly phone calls, just every Tuesday actually, with the governor for an hour. All local health departments, specifically with him. And what we are able to share on those conference calls was he is hearing what we are seeing in the community and what we are potentially recommending. He is telling us what he is thinking, why he is going to go ahead and potentially look at certain issues. It has really created a wonderful relationship that we didn't have before. And fifth, and which probably leads us into the next item, is a weakness in the community will be enhanced in a pandemic. And what I mean with that is what we are seeing in regards to health disparities or mistrust of government is what we are seeing enhanced right now. It is very difficult for us, specifically when you are talking about mistrust of government, that we are going to change that now in a pandemic. So what we are needing to do, and what I'm interested to hear today, is what really do we need to do to overcome that. We have tried to really look for champions in the community who can be our voice and carry our voice in that community, who may be a trusted resource in the community, so that we can really get the message out, what assistance is needed in that community. So with that, I think that's probably all I have for this time, and I'm open to what questions that you may have.
Not a
Yes.
question, but a comment. Last night on the national news on Rachel Maddow, MSNBC, she featured the opening of Nebraska Crossing and on April 24th. And in this morning's paper, it indicated that, albeit the governor and his, rules related to the virus, that this was supposed to stay in place until April 30th. And Nebraska Crossing is going to do a soft opening on the 24th. And I'm just wondering what kind of a message that sends to the citizens of Nebraska. And actually last night seeing this on the national news was just like, oh, that's not good. That's embarrassing.
You know what I would say, first of all, that area, of course, is not in Douglas County.
Right, I understand
and I just had a call with Sarah Schramm actually this morning about that. Second, I can tell you what has worked very well, because we have run through some of the same issues with some of the big box stores and so on. The mayor and I have really come out very clearly and said what our recommendations are. And I have to say, I've worked very closely with the mayor. I mean, she texts me at 10 o'clock at night or whenever the need is. She needs something from me or I need something from her. She has called these large businesses and said what her expectation really is, because she gets complaints on the hotline. I mean, they will tell you how many thousands of complaints that they are getting. And often when this happens, then we have voluntary compliance from businesses, but we also have businesses who are thinking they are just going to do what they think they can do. And so I do think voices matter and the community matters, and we need to all here stick together. So I'm disappointed about that, because I think what we are seeing is If you open things up too soon, you actually are going to see outbreaks.
Well, right. And another piece of this article was the kind of the byline was first shopping mall in the United States to open on April 24th.
Yeah, that's not what you want to hear. So there are always these, and I can share with you, Menards is one of the companies here in town who just think that they do not need to comply, and therefore have really been, from the governor's standpoint as well as also from the mayor's standpoint, very unresponsive to recommendations. So that is the difficulty.
Anybody else?
So yeah, I see it on a lot of the daily updates that Bill puts out. I really appreciate that stuff every day. A lot of times it'll talk about that X amount of cases are still under investigation, trying to figure out. Do those end up falling into a database somewhere else that to be able to see, like whether it's community spread or?
So there are several databases that are being used. So when the person who is COVID positive is the database, and then all those who are potential exposure to those individuals, they have to quarantine them. So they get recommendations of what they need to do for 14 days most of the time. And so they are in a database. Then there actually are individuals who can sign up online themselves, and they are then in what we call red cap. So from time to time, the nurses will call those individuals back and check on temperature, check on symptoms with them. Because it is, if those individuals who come down with symptoms, then the recommendation would be made for them to get to a healthcare provider, or at least to call a healthcare provider and have that discussion with them. So there are a lot of databases, but the databases are only as good as the information you put into them. So we now work on trying to really make sure that the quality of the data is correct. Yeah.
How available are the testing kits now versus a month ago? Or is it improved quite a bit, or is it still difficult to get done?
That's a good question. So the question is around testing. We are on a call with Nebraska Medicine and the laboratory every morning at 9 o'clock, actually, where we discuss about how many tests are available, who tests in our community, because in the beginning, remember, it was all testing through Nebraska Public Health Laboratory. And the tests needed to be confirmed by us. So couldn't just anybody go in and get tested. Then Nebraska Medicine developed their own tests. So then we had 2 testing sources. Then CHI came on board with their own testing sources, and they test now close to, I think, 300 tests a day, if not more. So that's for private healthcare provider. If you're on the CHI system, your healthcare, and you come in with symptoms, your healthcare provider actually may have you tested. There are certain clinics who are designed for COVID patients to get tested. But now what is happening is
certain clinics outside of the health system?
But they belong to the health system. So, each health system, instead of having everybody come in through all these different routes, they have designated, most of the health system have designated one of their clinics. And you would call them up and you would say, I have these symptoms and I just have travel. They would say, well, why don't you go to the clinic at blah, blah, blah. And then those individuals are prepared. They have the PPE and so on to get you tested. But now what is happening is that you may have heard on the national news too, Abbott has these point of care machines, what they call. So individuals could actually go into a healthcare provider, very similar to flu season when you go in. There are, not in the beginning, but usually in the middle when we know a little bit better what the outbreak is in flu, they can do actually the testing themselves in their clinic. And that's what in their doctor's office. That's what you are hearing now. We are hearing now there are 15 of these machines in Douglas County, but the case is now there are only 100 tests that can be run off those machines. That's how much extraction material we have and reagents we have. So it's still very limited at this time. The criteria, because the testing was so limited, the criteria was so you needed to be a healthcare provider, a healthcare worker, needed to have traveled, and needed to have symptoms, and there were especially 3 symptoms: a fever, a cough, shortness of breath, or you had contact with an individual. You were in the high-risk group, above 65, you had underlying illnesses. So the criteria was very tight. Up to now, honestly, we have not had any opening of individuals with no symptoms who could go and get tested in this community. We are starting to see that loosening up a little bit, but at this time, it's not so much the test, it's the reagents, it's the swabs that people are wondering and are concerned that we don't have enough. So, the last thing people want to do is overpromise something. So it's changing as we move on, but it's by far not optimal at this time.
And then we talk about the number of the ventilators that are available in the community. And as we potentially get closer to that peak, is there some type of communication or logistic systems that, obviously they're not all in one place. So to know, like, okay, so Lakeside has 10 available right now, or Bergen has 4, or is there, I'm assuming there's somebody.
Good question. So it's about, hospitals all are in it for themselves, so to say, because they are little organizations. They have their own profit margins and their own clients, so to say. But what has really worked out well is these healthcare coalitions. And a healthcare coalition is made up of all these different hospitals in our community. I think it's more than 14 hospitals who are in this coalition. So what they do is they meet on a regular basis to try to see how can we share resources so that we don't have 10 ventilators in one hospital being quiet and they could be needed over there. So that collaboration and these coalitions, there are, I think, about 5 or 6 of them across the state of Nebraska. So every hospital is in one of those coalitions and works together. And now what we are starting to see too is that potentially, from rural areas, individuals with COVID-19, especially those with very severe symptoms, may need to be transported to Douglas County, to one of the hospitals here, who has more expertise to kind of take care of those individuals. So that collaboration is really occurring nicely. So the other thing that is occurring is that the CEOs from all the local all the local hospitals are getting together usually on a Sunday, and are starting to talk about in a real emergency, what are the decisions that we as a hospital would need to make? And how can we have a document that all of us would treat people the same and the resources the same? So critical access, critical resources, and so on. So I'm really proud about the collaboration that is going on amongst hospitals, amongst public health, and so on in this community, because it's especially important in these instances.
Dr. Ford, so just when this rolled out, we had the first case in the state, and we kind of rolled into this with a stronger order. I guess from the conversation, just elaborate a little bit more, because it sounds like we're not going to roll out of this. We're going to roll out of this kind of together with the state, as the state set some principles on how to roll out. And I'm just thinking, have you gave some thought to this rollout and some of the conversation? Because it seems like you said, the reagent and all that is key. The testing part is key. So I want to kind of, if you can elaborate a little bit here to kind of temper this, because we got in early. I think really we were blessed enough to get in early with school being out, and that might have helped us. But the coming out of this, I just want people to be realistic and temper this down, because we might not be rolling out this on the 30th, because everywhere you hear this testing thing is so key. And even when you roll out of it, there is no normal anymore, because without the vaccine, you still have to do social distancing and other things. So I just wonder if you could paint the picture a little bit more about what you're thinking just off the top of your head as far as coming out of this. You already emphasized the importance probably of the groupness that has to happen with this, because we're not going to be rolling out of this first. And then Sarpy, Cass, Washington, everybody around us still kind of hanging on. You kind of come in different than you come out. So if you can elaborate on that a little more.
So that you are absolutely right. So what I foresee actually, and Shane is here, I think.
Hey,
Or is in the hallway. He's working on actually amending our direct health measures one more time, probably towards the end of this week. And why that is necessary, there is some really good language in the governor's direct health measures now around athletic groups for youth and for adults who are who are prohibited from taking care and playing through the end of May. And I would like to have that actually in our order too. There are some things that the governor took from our order and put it in his order, mainly in regards to hair salons, nail salons, massage parlors, and so on. But he also put in gentlemen's club in his order, which we do not have very specifically in our order. And I would like some of that language in. So we'll amend our order to mirror, to a certain degree, not all, but mirror somewhat I think is important to have in our order. So then yesterday we had a discussion with the governor actually, how is this going to go forward when we are starting to loosening up some of the restrictions. And I get a lot of questions from the chamber at this time, because there is a good document out there that talks about a roadmap for loosening up restrictions. I think those will be discussions where we bring groups together from business and from public health to see how that will go. It will be rolling out slowly. It will not be an opening up and everything is back to normal. But there are some things in my mind, and also probably in the governor's mind, that we could start thinking about what that would look like. And I think once we have some more information, I'd be more than happy to share that with you. I am not so sure, Commissioner, what you are asking, how I would answer you. If all of this, everything would be lifted equally across the state or not. Because there are differences. I would tell you, I feel very strongly that potentially Western Nebraska is a little bit behind what we are seeing here on the eastern part of the state. So we need to be very careful, and really it is data that is going to provide us and educate us of what is going on. And so where they are seeing now some serious outbreaks in long-term care facilities, as well as in packing houses in the Grand Island area. Potentially Grand Island could, in regards to numbers, could exceed Douglas County pretty soon if that continues to be the case. So I would see there may still be a restriction locally and not opening it up statewide. That's a long answer to a very short question. It's a difficult answer.
No, I mean, I want to kind of set the stage with it, because the fact is that it is. And there's going to be a lot of people asking this question. And even, just looking at this, Grand Island has 60,000 people and they got 214 cases.
Yes.
Yeah, I saw that jump yesterday and that was different, but I think the point you made of just the flexibility of this, I don't know if it's fair to say that we're trying to do the best you can on making conservative choices, but every day there is no right or wrong answer, and it's almost like adjusting as you see the data, trying to guide this thing as it goes. But I just want to kind of set the stage why people are there. I'm saying, I think one, we're looking at data. There is no 100% right or wrong answer as you go on. You're trying to make this choice based on the most conservative piece of the principles of distancing and other things like that. But one that, because I'm getting calls thinking, are we coming out of this? I'm like, you need to give me a week or two to see what happens next week on this supposed peak period, and just telling everybody to brace a little bit, because this may not be clean. I mean, that 30th day, but it's not going to be as clean coming out.
We are looking now, as they do nationally, how are our numbers doubling? And we are doubling about in 10 days. So that's what we have seen. So we are looking at that doubling time in numbers regularly now to really give us some indication of what are we seeing in our community.
And the peak isn't supposed to occur for another couple of weeks, correct?
Till the end of
And
potentially the end of April.
And we're at 901 cases right now
For the state.
for the state, right? So, so how is the governor updated national level every day as well as from the state, or do you have any sense?
I don't know. I don't know about that.
Okay.
Dr. Cole,
Yes.
for testing, big cohort, like someone like me who calls as an exposure, I'm going to be told just to shelter at home, even with symptoms. So are we keeping track of those numbers that aren't being tested? I mean, because we have a potential there, a large number.
So that's a really good question. And you are seeing this now occurring, that physicians are saying you call in with your symptoms, and the physician, your symptoms look like you have COVID-19. Just stay home for 2 weeks, observe your symptoms. If they worsen, give me a call. No, we are not. There is not a system that those individuals will be in a database. So that is occurring, and I think we just need to be aware in our community that more and more you will see that. The other thing is also, if you do a point of care testing in a clinic, those results are not reported to the Douglas County Health Department.
So we're really guessing our
Yes.
number is.
So we are guessing. The same thing is with syndromic surveillance. That data is not. We only are seeing how many individuals are coming to the emergency room with respiratory symptoms. So this actually brings me to another issue that is brewing, and you have heard it brewing, and that is emergency responders and law enforcement wanting to know addresses of COVID-19 patients. I'm all for safety of law enforcement and emergency responders, but the picture is not complete. They are not getting a complete picture. So, potentially we are saying at this time, COVID-19 is in our community, and you really should take universal precautions wherever you go. I will have a meeting with some of law enforcement today, potentially try to see what are their concerns and how can we kind of meet together. But you are absolutely right. Pretty soon, we only hear about the tip of the iceberg, and we don't know.
It's the same as when they calculate the mortality rates. They don't just take positive and negatives
Exactly.
and mortality. They make an assumption that there's a magnitude of 10.
Yeah.
Do we have an idea what we're assuming we're actually at, magnitude-wise?
No, I don't think we have a good idea.
Then one other question. So of 101, and yesterday it was 70 and 11 ventilators used. 70 total used and 11 were COVID, and today
Yeah.
reported 101 and 15. So 85% are non-COVID.
Correct. You still
Are-
have the individual with
that have
underlying.
Lung issues,
Yes. Yes.
traffic accidents, et cetera, et cetera. When are we going to be at a point where by putting off, and I'm not just talking financial impact on hospitals, because that's also taking place, putting off elective surgeries. Elective is a fine line, because elective for a patient this week could be life-threatening 2 weeks later if you put it off long enough. Brain aneurysms, et cetera, et cetera. When you go down the list, and I'm not a medical doctor, it goes with dentistry too. You know, a cavity today, elective is a root canal in a week, potentially. And we see the same thing, and we have to make that judgment call. But are we going to be at a point where we're going to overutilize potentially ventilators with non-COVID patients because we've been kicking procedures down?
So it's interesting that you are asking this question, because this is exactly the discussion we are having at this time. And, you know, the discussion is probably different in rural Nebraska than in urban Nebraska, again, because of the resources that we have available. But rural hospitals, they are really suffering financially from not having those elective surgeries. So some hospitals are actually at a point where they are saying, do we need to close? And is that really in favor then when you have COVID outbreaks into your communities and you have hospital closures? So it's that balance that is really being discussed at this time. I'm glad that you are.
Yeah, so a friend of mine's daughter is the nurse, head nurse at hospital currently. Have to worry about, you know, are they going to be able to spin it? And then you know, next time this comes around, do we lose hospitals because we push this far down? I mean, we could lose hospital systems, which is our bottom line of bed numbers.
And you know, I just want to share with you too, I actually do not think when I amend the direct health measures, we will not include elective surgeries in our directive health. That doesn't mean anything because the governor still has it in his at this time. But I just feel that there needs to be some more discussions when I see the numbers. And it may not be all elective surgery, and maybe there are some special tiers there too. So those are the discussions that are occurring.
I know in dentistry we're trying to find a way to open back up to it. I kind of had dentistry. I was ashamed that we shut down instantly and didn't instead ask about how small businesses were going to be affected by it, instead of asking how it could help the problem. And I know we went through this with H1N1. Heaven forbid, you know, had hydrochloroquine worked, you know, had we stayed, we could have been a distribution site. You know, we talked about that with H1N1 because we have medical histories, et cetera, or vaccines. You know, we had developed something. You know, there we could run through, I think it's 78% to 80%, depending on our studies, have dental homes. The dentist could have been a front line to whip through the patients quickly and efficiently with PPE. And so we're looking at ways to get it open back up with PPE and taking precautions. And when we do emergencies, we're working around it like every other industry is. But one other aspect on that is with New York, you know, we had the board of trustees meeting, and the trustee up there said that actually people who got sick in the dental offices were the front desk workers. So, and that's just observational data at this point. So,
But you know, if it's
we're
in
learning
the
more every.
community,
Yeah.
it doesn't matter.
It doesn't
what
matter,
job you
yeah.
have.
Okay, Dr. Particular. For the next stage, if you're going to break in.
So I do think we wanted to have some discussion also with having Andreas Gorkin and Kenny on there to really talk about potential, what do we need to do outreach in the minority community, and how can we serve that community. I do not want to come back a month from now and say, you know, we should have done this, we should have done, why didn't we do it? So I would like to have some input also from Andrea and Kenny to see, I think the discussion that Commissioner Rogers and I had about testing and access to vulnerable populations.
Who do you want to bring? Are you all connected? Can you hear? Okay, Andrew, we can start with you. Come on. Is it a way to turn? Wait a minute, Andrew, we trying to see if we can turn your volume up. Nah.
Speaker.
This one.
Talk now. Okay, we need a little louder because it is a little loud. I thought it was.
We're working on our side to turn the volume
It's on
up.
our side. We're trying to get the volume up. Yeah, yours a little better.
Accessibility shortcuts, 8 items, voice guide, off.
Let me see if we put one of these mics here. Well,
Yeah, good, that's good.
All right, Andrew, give it a try. We'll see if we can get here. I don't know if it helped, Danny. It's about the same, but go ahead. We'll try to work our way through it.
Speaker. Right.
Okay, Andrew, hold on. We got you up a little more. So if you want to restart, and again, let me just set it. I mean, I would just say give us an idea on where you're at. One, testing wise, what you're seeing coming down the line, and what areas of concern you may have, and just general overview. Yeah, hey, Andrew, let me ask you, what's going on in, well, from our number 68105, that's down there in your area in South Omaha? You got any indication of just what you think may be going on? Because that's one of the higher numbers zip code wise in the county. Yeah. Okay. Okay. Anybody else? All right. I think that's all the questions right now for you, Andrew. Kenny? Yep. Okay. Hey, oh, go ahead, Kenny.
Andrea, and Kenny, do we have any sense of whether or not these meatpacking companies have on-site nurses, occupational health nurses?
So, Andrea, how many people, oh, wait a minute, how many, is that so your concern is raised in Iowa? Do you have a lot of patients coming from Omaha to go over into Iowa to work? In that respect?
So can I just say
Go ahead.
something to the houses? So I agree with you, Andrea. We also are very concerned. So we have reached out to two of them, and the mayor has reached out to another two, and we have received some plans specifically from Greater Omaha Packing. They have sent us their plan yesterday. Then there is a GBC company who has really had good discussion with our staff about what they are doing, trying to get some recommendations for them. And I think we are at a point now. And then also the mayor has reached out to the meatpacking lobbyist to kind of see if we can get some communication out that way. So I think in the next day or two, we may need to reach out to more of them, try to see what their plans are. I think many of them have heard what's happening to their sister companies, either in South Dakota or Grand Island or so on, and are really beefing up their measures, so to say. But I do think to have that contact is really important for us, and we'll reach out. And if you can reach out, or if you can let us know who some of the individuals are that we need to contact, I'd be more than happy to receive that information and have a discussion with them.
Kenny, I think I cut you off. Would you say something? So explain that, am I right? I've heard it a couple of times, but I needed to click a couple more. The waiver is the work requirement plan that allows you to get Prime, which allows you to get vision and dental. Okay. Let me ask one more question. What are you all doing telehealth now, right? So with that, what are you seeing or expecting from your behavioral health arm? What I said, based on doing telehealth, what are you seeing right now, or what are you expecting from your behavioral health service? Okay. So, I don't see anything else, but just, I know there was a little confusion based on that story Monday. I mean, do you all want to clarify anything regarding the testing and what you all are doing and how you may be accepting people? Somebody may need to mute. Somebody all may need to mute. The upcoming elections, basically, there's acts, but as of right now, those are going on. Everybody's being encouraged to vote by mail. But as of right now, from what the governor said and the date for some of those orders, there's limited polling places open, but the election is going to go on as is, and everybody's encouraged to vote by mail. The homeless shelters, I have to check on those plans. See, I haven't got anything updated on those particular.
So I just can tell you, Andrea, in regards to the food pantries and the homeless shelters, the mayor has a community advisory group, and every Friday we meet with them to really see and try to see where there are gaps and how those gaps can be filled. And the food pantries have been on those calls. So have the homeless shelters. The homeless shelters really, through Match, their association, they really have worked together to try to see how would they quarantine or potentially even isolate individuals in the homeless population. So they have a pretty robust plan. It has not been tested at this time because we haven't had an individual who needed quarantine or isolation. So, plan is only as good as it can be implemented.
I have a question for both Andrea and Kenny. I don't know if there's a difference between two of you, but one of my primary concerns with the closing of dentistry and orthopedics and everything else was the uptick of opioids to manage people, why they wait for procedures, and then also ED utilization, because there you're dealing with a toothache that's solved probably 3 times the man hours and 4 times BE, I'm guessing. Are you guys seeing an uptick with that? I mean, I know what you're doing telehealth, you can't call in a lot of those scripts, but is that an issue you guys see potentially rising?
Okay, I don't see any more questions here. So, thank you all for the update and just keep in touch as things develop and what's needed, try to stay ahead of it. Appreciate all the work. Good, see you all. Now there are no presentations, but the reports for the departments were sent out. Does anybody have any questions on the reports that were sent out? Dr. Poor, I got one. This is the only person I've got anything from, and it's a question about the fees. It's a food truck guy. And so I think I copied you on the original one. I thought this guy was a restaurant, but I don't know if the answer is kind of still the same to some degree. And I'm wondering what thought have you all given to that on some degree?
So that was the question. The question about the food trucks and if they could, because some of the festivals are not going to be held this summer, and so they, Taste of Omaha and so on. But the food trucks, Joe felt very strongly, they have an opportunity to actually now get business, and so he wasn't going to go and change the fee for the food trucks, so to say. And I have sent Joe that individual. Actually, I think I talked to the person, and Joe has talked to him several times. So we are trying to make arrangement when necessary or when qualified, but the food trucks are not changes that we have.
And because I'm going to just respond to him and say my understanding is you've got some communication because they're like looking to see if we're going to do some higher deal. But you're saying they got opportunities because they're mobile. They can probably do some delivery and other stuff like that. Okay. All right. Any other questions on those items?
Maybe just a statement that Carol, everyone talks about what Dr. Ford and the whole group stepped up during this, but the preparedness that the health department's done should be commended immensely. Carol, I see your name there, and just can't help but think that what they've done. We've had dry runs from H1N1 and DMORTS and a lot of things to put in all the wheels in motion. So I want to commend the whole health department. So
thanks. It's well deserved for the whole health department. So I agree with you.
Yeah, to Dr. Manali's point, I've been on a couple of points with people, and unfortunately, they only see the health department if there's a pool that needs to be closed and the restaurant. But the point I make to them is that anything that's come through it infectious disease wise, the health department has been a quiet partner with it. It's just this time they've had to be public, and you see behind the scenes on it. But I can't reiterate enough for the staff. We've been through this run a couple of times, but this really points out and brings a heightened awareness to where the health department is in your communities. And I just throw out there for the board the future thought. At some point this will pass, and when we come out of this, the world of public health is definitely going to be different, and then probably puts the board at another point. I know we did a strategic plan at one point. As a matter of fact, I was looking through it, brought through it last night. Some of those things may have been sped up because of this and looking through it, but I do think the world's going to change to some degree, and we need to be ready to help with that from education piece and other things. But Dr. Ford, there was one point I do want to ask before we get close to the end, and your guess, and I don't know if Tim has done numbers on this or not, but even this point of saying when we slowly ramp up and to get there, because you don't have the vaccine, there's the test piece. But do you want to elaborate a little bit on the amount of resource just staff-wise that is going to take if you open up, and what may need to be asked to do all of this follow-up, because the capacity that you have right now is there. And I've heard this conversation through some other mediums, and saying that the federal government wants to get there at a certain point. It's not just the testing. Some of these follow-up pieces are going to have to be done by people. And I don't know of any health department across the country that has the manpower to do that. So will you elaborate a little bit on that before we get out?
So what you are talking about is what we are going to start seeing is we're going to see more contact investigation, how important that is going to be. And, you know, I say that to staff all the time. I mean, that is the important work of local public health in this situation. Specifically as we move forward and relax some of those restrictions in the future, we really need to be able to trace every single one person and see where the exposure occurs and who is around. So we are talking often, and I ask epidemiologists and our disease investigators, what would it really take? It probably would take about doubling the staff in that section than what we have right now. And you know, these things you cannot do in the last minute. We were fortunate to have some nurses on staff who we could train. But some of the offers that we are getting from the College of Public Health at this time, there are students who could help us. So they go and come. And you really need to have the training. And I tell you to do a contact investigation. It's not somebody from everybody who can do it. It really takes what I call them, they are like police detectives, you know, and that's how we found out the first community-related case. It was because somebody went back to that woman and said, and you traveled to England, and not to England, she traveled to the East Coast where there was a lot of COVID-19. So the first thought was, well, this is travel-related. It's like what we have. It wasn't until they said, and when did your symptoms really start? It's that digging, that calling more than once and try to find out information. And if you don't have that in you, that you have that curiosity where you want people, you are never going to get good questions. And I can tell you right now, there are interviewers who are better than others. It is a quality that you can train, but it also needs to be a little bit your personality for it. So I would say to your question, it probably would mean double our EPI staff at this time. And what staff is telling me, you know, we have systems, data systems that are old, that are added on over the years, and are now not able to be robust enough to handle all the data that we need to handle. And so we talk a lot about what it really take to have good systems in place where you could actually then pull out data, because here I come every day and have a different question and say, can you tell me what is this and how many individuals? That's the other investment that I think needs to be made to really have a robust data system. So both people and data systems.
And the CARES dollars that were made available through the initial investment from the federal government, as a health department, can you access those dollars?
Some of
to help support FTE, programming, software?
Some of them we can, but remember all those CARE dollars. If we have just one-time items, like let's say, for example, a data system or so, that may very well be. Ongoing FTEs, that's probably not what the CARE dollars are for in the future. Right now, we actually just send into the state government our expenditures for starting April 1 through the end of May for a 2 months period to kind of say overtime is enormous for us at this time. So we are looking at what are potential sources of funding, and the CARE dollars are definitely one for the data system that may work for that.
Yeah, I think, Jenny, your question is, I think, in the CARES Act, you know, there's a clause in there that entities over 500,000 can get direct funds, and in the state, I think Douglas County is the only one that's there. So that conversation is happening. But, and I don't say this lightly now, because the frame of public health is going to change. I mean, it was in the strategic plan, and we mentioned this, and that's why I say this to the board as a whole. You know, I've had some conversations with just a few members on the board, and the time may not be right because things are not settled. But the board has had this conversation before about the levy that's available to health departments. And I think it would malpractice, for sake of a medical term, if we didn't have some serious talk about that, because the infrastructure that's going to be needed from here on out is kind of going to be upgraded. It's going to need to be upgraded, and the funds that you get from the CARES Act, I think a lot of that is triggered by costs that you incurred after a certain point, because a lot of the discussion around the country in every institution is what about stuff we put up front, and I don't think that covers that. So, you know, a lot of this infrastructure is going to have to be owned by government because that's the work they need to do, and I think the board needs to really think through that, because of where the board wanted to try to get to policy-wise, this is the first imminent policy test. And so I think, you know, there's an education piece I think comes out of this for the board and the department that they can lead people forward just for the community when it comes. And so I just say that for everybody to think through, because, you know, trying to get my own mindset right for opportunities. You know, I had a book by Dr. Khan, gave me as a gift, and I kind of flipped through it. I kind of read through the book in 2 weeks, and the next pandemic. And then there's the other book that's getting a lot of attention, and I'm kind of halfway through, called The Great Influenza, which basically takes you back. And I do think we're going to have to really think about how it is, because not only before we had the pandemic, you've had the big discussion about that big biocontainment unit at UNMC. And it's kind of hard to have a facility like that and not have your health department up to speed to be able to happen when things trigger. And so, at least here in this county and our health department in particular, we're in another realm when it comes to public health from here on out. And everybody just needs to think about that and how it fits in and how you go. So that's some of the thought that I've been going through, and hopefully everybody else can get their head wrapped around that when Dr. Ford and these guys come out of the cloud of everything that's going on and kind of this fall of war, and we get ready to think, you know, not only handle this, but walk it through calm and think about what the post department looks like. So if there's any time to do it, that's now.
And when I was like reading the reports, what I was very struck by was that your EBI department was going, you know, 7 days a week, 24 hours. That is not sustainable. So I think that I saw that as a huge priority of figuring out how do you alleviate some of that stress, and what can we do as a board so that you can do that.
And you know, it's a huge concern, because it really wasn't until probably last week that we really tried to see how can we give 2 days off in a row. Because we all know you can only do those things for a certain amount of time. And the same is with the information line. You know, those individuals. I think we underestimated the emotional toll, because if you are getting all these frustrated calls, I mean, Sunday is a good example. I mean, there are people screaming at her on the phone, and I can hear it in my office where she's saying, "You don't need to scream at me." But people are frustrated, and then once they get somebody on the line, and I tell you, we actually have developed some resources for our staff so they can have some emotional support in those.
Like they're
So-
dealing with, I'm sure, kids at home too that are homeschooling. I mean, they
Sure.
are going home to all the other stresses that
Yeah.
are.
Absolutely, and they are afraid also, you know, some of them do need to come to Europe. They're afraid about that. Yeah, it's a lot. And, you know, what you are saying for in the department is absolutely something that we are looking for. What are the additional resources that we could do to actually prepare ourselves? And we need to be prepared with having a biocontainment unit in our backyard, so to say.
And I think at some point, just if you're talking about doubling the staff, it definitely can't be contained in this building. And so, yeah, you know, it's thinking that you want to do and go from there. So if anybody has any questions, concerns, just want to reiterate to the staff the thanks, can't say it enough right now, and to all those health industry related staff, particularly in grocery workers that are on their time, to thank them for it and ask everybody for their patience. continued patience every day as we go through this. So with that, and being no need for exec session, I just want to note that I talked to you about it last time, but it's been ratified today. Selena Espinosa, who's the newest board member here, we're glad to have her. Give her some remarks before we leave, if she wants to introduce herself to the board and things of that sort.
Thank you. It's an honor to be here. My name is Selena Espinosa. I've been a surgical assistant for 18 years and worked with Methodist and CHI Health. I'm also the chairperson for CHI Hispanic Outreach Group, and I've done quite a bit of work in the past year with the Hispanic community. Very honored to be part of this board, and I'm ready to serve, and I think this is a great time of need for my community. I have personal experience as a frontline employee in medical services, but also as a community member. Both of my parents have worked in meat packing houses for 45 years. And I think that's one of my main concerns as well for those people that are working in such close proximity, and very limited PPE has been provided. So working forward, that's going to be, I think, one of my main focus. I appreciate everyone's welcome, and I'm really glad to be here.
And from our conversation, John, you appreciate her family owns a restaurant?
Correct. We
So-
own Howard's, and
Okay.
we have 3 other restaurants in town.
So she's not in the business, but she's sympathetic to your work.
Absolutely.
She didn't follow in the family's business, so yeah.
No,
Okay.
the rebel.
Okay, with that, is there a motion to adjourn?
So
Motion and a second. Roll call.
Wade.
Yes.
Gray.
Yeah.
McNally.
Yes.
Rogers.
Yes.
Wilkin.
Yes.
Weiss.
yes.
Thank you all. Appreciate it.